Sanjay, you used the right expression. This is really crime against humanity, against ourselves. Unfulfilled potential, and that's what lack of education to the bulk of the people means really. That's the greatest sin. The second is avoidable suffering, and that's what lack of health care means to the bulk of the people. It's the greatest sin. So these two, to my mind, are India's greatest sins today. And you are absolutely on target when you describe them as crimes. But again, if you look at the evidence in the past 10, 15 years, the last decade saw the greatest improvement in literacy in the country. That means after decades of neglect, the governance system across the political spectrum is now coming to recognize that these are issues which are important. We are not effective yet. We are only still talking in terms of more enrollment and just literacy. Even literacy figures are somewhat dubious. We are not really going by functional literacy standards. So we are nowhere near what we talked about, but the direction is right on the whole. The discourse has now become one of the important issues of public discourse, and I think that's a happy outcome. And similarly, recently if you see the resource allocation, the cess for instance, the beauty is not only that the resources are now made available, but nobody resisted this cess. The whole country across the spectrum decided, look, it's something worthwhile. This must be done for our children. That means the society has now found that will, which is a good thing. But I suspect we still haven't found the means of doing things, the methods of doing things. That we have resources is not enough. We also have to find mechanisms of doing that well. So both the school's quality in terms of outcomes, we must go beyond enrollment, beyond keeping the children at school, beyond reducing the dropout ratios. We must actually go into outcomes of education. We must also look at higher education. Is that true? That has been largely neglected. And the mistaken notion that if school education is taken care of, higher education will take care of itself. And also the belief that higher education actually is good. I think both are dangerous assumptions. The crisis in school education is now creating a crisis in higher education. And the vicious cycle is established. Higher education crisis is now affecting the schools. And second, higher education itself is in a deep mess. So I think we have to look at that too. I think we are not looking at these qualitative aspects into higher education. But I think a beginning is made. But now the civil society and the education community must look at the bigger issues. People like Pratham in Mumbai have done and are doing outstanding work in terms of promotion of literacy as an issue, and also in providing literacy to the people at a low cost and a very short span of time. But that's a starting point. We have to go much farther. Healthcare, I think we are still lagging behind education, because public health in India is one of the worst in the world. By any standards, we are really ignoble. 0.9% of the GDP is spent in public health. It's one of the worst in the world. Only 17% of the total health expenditure is spent on public health. The rest is private healthcare expenditure, mostly out of pocket. Again, one of the lowest in the world. We are comparable only to 3 or 4 of the terrible countries in the world, like Burma, like Georgia, like Afghanistan, like Cambodia. About 60% of the annual income is spent on one episode of hospitalization for an average Indian, whether it's in government hospital or private hospital, making people completely impoverished. It's a financial disaster if you have to be admitted in a hospital for most people in the country. So there are terrible, terrible outcomes of neglect of health care. I think we have to focus on health care, preventive health and curative health both. And it's not merely an issue of allocations. We require much, much more money. But we must go beyond merely allocation of money, because the government's answer to any problem is I'll open my checkbook and write a bigger check. That's necessary, but it's by no means sufficient. You put in more money, it goes down the drain without looking at the systems. For instance, you take the hospital care. You must look at choice for the patients, even in the public hospitals. You must look at competition among the public hospitals. You must look at a system where money follows the patient. So the hospital has to actually deliver and then collect the reimbursements for the services rendered. And you must look at some kind of outcome analysis through proper surveys, random sample surveys, etc. You must have auditing of a different kind, not expenditure audit, but outcomes audit, performance audit. Similarly, if you look at the primary health centers, you must change the accountability. You must make them accountable to the local government, so that locally there is a link between the performance there and the public appreciation, and therefore the vote and the political outcomes. So we have to radically redesign the way the system works in terms of accountability, in terms of incentives. And I believe that, along with the outcomes, additional allocations will change things. And the governments, irrespective of which party they belong to, the National Health Policy of 2002, India government was in office at the time, they talked about 2% GDP going to healthcare. The current government talks about 2 to 3% GDP going to healthcare. So there is now increasing political commitment. We must actually now make the political system act, stick to what they have committed. And that's what many of us are attempting to do. And I think civil society has a tremendous role to play in both. And I entirely agree with you. These are two crimes, and we have to address them. We have to find innovative solutions. For a long time in India, there has been a lot of thinking about networking and some action too. But I believe there are three things missing in our approach. If we overcome those deficiencies, probably all of us together as citizens and citizens groups, we can be far more effective in our work. The first is oft-repeated truism: think global but act local. We are acting locally, but I suspect not many of us are able to think globally sufficiently. If we do not contextualize our actions, our local actions, in the larger tapestry of the national issues and the governance, then beyond a point we'll find that there's a dead end. We'll only hit a roadblock and we don't know how to go beyond that. The second is, how do we network in a manner that actually we synergize? It's not merely learning, it's also gaining the expertise and becoming very powerful instruments of change, engines of change. You mentioned Janagraha, for instance. Janagraha is showing how citizens' participation can be truly effective through very powerful tools and highly professional and competent approach. So they are combining the heart with the mind. And I think this fusion of heart with the mind is a critical requirement. And many civil society organizations are very large in heart, but the mind is not as large as it should be. And I think it's time that we now fused both. The third is the centrality of the larger governance framework. And therefore, even as I do whatever I believe is necessary in Mumbai city, in Bangalore city, or in a village, or in a town, I also look at the larger issues of governance. You mentioned the justice system, the issue of decentralization, the issue of political reform, the issue of accountability, right to information, citizens' charters. In Mumbai, if you take the ward committees, for instance, we have to really have a look at not ward committees as your ward officer level, but as municipal councillor division, the corporator divisions level. You must have a committee of the local inhabitants through a legitimate process, which actually has control of resources and responsibility for functions and supervises and monitors the functionaries. In other words, you're creating a sub-municipality within the corporation, giving them some specific tasks to be locally handled. Now you don't have to go to a ward officer or a municipal commissioner with your complaints about street lighting or something else. Why? You handle yourself. If you mess up your local life in that mohalla, it's your problem. And then depending on the locality, give them some resources, significant resources. For the poor localities, give all resources locally raised. For richer localities, give them a part of the tax resources locally raised. So you can have a formula. There are ways of doing it. But for that to happen, we all must create a framework both nationally and locally. For instance, here, if Maharashtra law has to be changed, the municipal law has to be changed, then we must look at our Maharashtra issue. The Constitution already provides space under 243S, the Article 243S. Now we have to make it operative in Maharashtra. So we have to go beyond Mumbai city. We are not big enough, even Mumbai is not big enough. Similarly, across the country there are many issues like that. If you look at the political systems, you require a national framework. Therefore, what I believe is, and that's what Lok Satta and many other civil society groups and movements are trying to do, Janagraha is one of them, and many other groups all over the country are coming together. We are building a movement called Janadesh. There is a website, janadesh.org. It is specifically aimed at the larger political system reforms. But simultaneously, in each of our cities, if we merely wait for political system reforms across the country, which we can't translate into reality in one day, and if they don't apply specifically to my city and my mohalla, then my interest flags. Therefore, how do I make sure that in my city I can make an impact? Therefore, the ward committees in Mumbai. So in that city, all the hundreds of Mumbai-based civil society organizations must look at this as a mechanism. How do I create this legal framework by which we can actually create a mechanism so that it can be applied in every mohalla? Without that framework, each time you have to reinvent the wheel. Each time there's some innovative experiment, but it's not sustainable because there is no container. You only have the liquid, that energy of the people, but without the container, the legal framework, it gets dissipated after some time. Therefore, even as we continue our civil society work as citizens, I think we have to work together to bring about these institutional outcomes, like a ward committee, for instance. And for that, again, Lok Satta is working with all the groups, not to duplicate the efforts of many people, but to add value to it, to give an added edge, so that whatever we do actually gives us much greater outcomes. And that's what I believe we require.